Hey everyone, Derek from Veritasium here. This video is about something that can happen in an instant, something that takes lives without warning: sudden cardiac death. Now, this isn't just a heart attack, although that's related. Sudden cardiac death, or SCD, is when the heart unexpectedly stops beating altogether, leading to a sudden stop in blood flow to the brain and other vital organs. It's an abrupt electrical malfunction. So what are the underlying heart conditions that can trigger such a catastrophic event? Let's investigate. The single most common culprit behind sudden cardiac death is coronary artery disease. You've probably heard of it. Over years, fatty deposits or plaques build up on the inner walls of the arteries that supply blood to the heart muscle itself. This process is called atherosclerosis. For a long time, this might not cause any symptoms, but if one of these plaques suddenly ruptures, a blood clot can form on its surface, completely blocking the artery. This is a heart attack. The sudden cutoff of blood and oxygen can destabilize the heart's electrical system, triggering a fatal arrhythmia and causing the heart to stop. It's a chain reaction that starts silently but ends devastatingly. Next, we have a group of diseases called cardiomyopathies. These are conditions that directly damage the heart muscle, making it weak, thick, or rigid. One of the most notorious is hypertrophic cardiomyopathy, often an inherited condition where the heart muscle, particularly in the main pumping chamber, becomes abnormally thick. This thickened muscle can obstruct blood flow out of the heart and, more dangerously, disrupt the orderly spread of electrical signals. Imagine trying to send a wave through a lumpy, uneven surface instead of a smooth one. The signal gets chaotic. This chaos can lead to life-threatening arrhythmias and sudden death, which is why it's a leading cause of SCD in young athletes. Beyond the plumbing in the muscle, there's the heart's own internal wiring, its electrical system. Sometimes the problem isn't a blockage or a thickened wall, but a primary malfunction in the very system that tells the heart when to beat. Conditions like Brugada syndrome or long QT syndrome are genetic disorders that affect the ion channels in heart cells, making the heart electrically unstable and prone to dangerously fast, chaotic rhythms like ventricular fibrillation. In this state, the heart's lower chambers just quiver uselessly instead of pumping blood. On an EKG, it's a picture of pure electrical chaos, and without an immediate shock to reset the rhythm, it leads to sudden death within minutes. Finally, there are several other less common but equally serious factors. Congenital abnormalities, like being born with coronary arteries that are incorrectly routed, can be a hidden danger. The use of recreational drugs, such as cocaine, can put immense stress on the heart and provoke a fatal arrhythmia, even in an otherwise healthy person. Then there are severe infections or inflammation of the heart muscle, known as myocarditis. Any of these can create the perfect storm for the heart's electrical system to short-circuit, leading to a sudden, final stop. So we've seen that sudden cardiac death isn't just one thing. It's the tragic endpoint of several underlying conditions, from blocked arteries and diseased muscle to faulty electrical wiring. The key takeaway is that while it appears sudden, the causes are often long developing. Recognizing risk factors, getting screened if you have a family history, and paying attention to symptoms like chest pain, fainting, or unexplained shortness of breath are crucial. Understanding these hidden dangers is the first step toward preventing them, turning a potential tragedy into a manageable condition. Thanks for watching.